quickly covering, why are you all here today? So what is today all about? So we're going to talk about self-evaluation and improvement planning. So we'll have a quick chat about what self-evaluation actually is and why should we really care about it. Then we'll have Linda taking us through a bit more detail on self-evaluation and social care services, including all the tools and guidance available to help you with this from the inspectorate. We'll also talk about the model of improvement and how it helps us with planning and tracking improvements. We'll share a few success stories from a few of the services. A couple of them will be able to speak to it themselves. And one of the stories we've got that the person could be there, but Louise will speak to the story to fill you in. We'll then round it off with a few top tips and see how you found it and what you'd like to take away from the webinar today. Okay, so to ease you in gently into interacting with us, let's warm up our fingers and start with a simple question to ease us in. So next slide, please, Jenny. So there you go. So grab your phones, please, and tell us which part of the country you're joining us from. And Jenny's kindly dropped the QR code at the side as well, and some of the links. So if either way, you can get onto our slides and tell us. Brilliant. See lots of answers coming through. It's brilliant to see the spread throughout the country. We've got a few folk from Edinburgh, Glasgow, Ayrshire, Paisley, Falkirk. I find word counts always funny because it just kind of keeps moving and turning and twisting. But it's good in a way because it also shows you where more people are giving the same answer kind of thing. We've got some folk from Aberdeenshire near me, some Perthshire folk. Now, I wouldn't try and pronounce Ecclefechan, or I just did. Eastern Bartonshire, Rutherglen, brilliant. Right, so everybody has a good idea of how we go about using this. So let's now maybe move on to our topic. So next slide, please. Jenny, thank you. So we're talking about self-evaluation. What's our service about? So let's start with asking you the simple question. Tell us what's good about your service. What makes you proud to be a part of your service? What gets you up in the morning and into your workplace? Answers are coming in thick and fast. What are you seeing here, Louise?
Well, we're seeing lots of lovely stuff around the rationale for people getting involved. And what Focusing is really good about their service includes the people. There's a lot of relationships about the residents, the staff, the teamwork. There's a great deal about a sense of fulfillment around helping people, about aiming, to help residents have a good life, feel happy, and so on, and a feeling of doing a good job, like going ahead, going above and beyond. So feeling that you're really doing a good job and enabling people and so on. So I think they're mainly the
all the good things
there
that make us feel special, that we have the privilege to work in social care.
Yeah.
Cool. Brilliant. So let's move on to the next one. So this is a follow-up question for you. How do you know these things are good in your service? What tells you that these things are what is good in your service?
So this is a bit trickier because we've had some lovely ideas about what's good about the service, but how do you know? How do you know? So there's lots of good things here about, asking people. And mention of staff, residents, and family feedback. So a really good way to know that things are good is by asking people. And of course, that is so true. And then we have some more things that are a little bit more focused and detailed, perhaps using surveys, getting specific feedback, and again, customer feedback, feedback from families, and then moving into the areas of auditing. And feedback from residents and staff. And maybe if you could, thanks, Jenny. Laughter And isn't that lovely? Actually noticing what's happening in
Absolutely.
the place. What's going on here? What's it like to be here? And of course, obviously, we're talking here, there's mention of residents and so on. And we don't know where you guys are coming from, but it may well be from care at home services or daycare services or sheltered housing as well. So in terms of observation, a very nice one there about care inspector grades, and getting people home. Oh, how lovely is that? And I'm not sure who that person is calling from, but actually, if you're helping people move to where they want to or get to where they want to, very important. And a really nice one there about the other people on the team, because if everybody wants to go to work every day, that's a really good reflection of the culture and the atmosphere in a place of work. So lots of really good things there.
Perfect. Thank you, Louise. This is brilliant. I mean, these responses make it much easier for me to talk about the next couple of little things. So let's move on to what self-evaluation actually is with a little definition or two. So next slide, please, Louise. Sorry, Jenny. Yeah, so in basic, Cambridge Dictionary would define it basically as a judgment we make about the performance of our company. Coming a bit closer to social care, Audit Scotland would describe it as when a service systematically examines itself to assess whether it's meeting its stated objectives and being able to deliver the outcomes that we set out to deliver efficiently and effectively. Our self-evaluation guide really helps us further into thinking about this, because it's, it mentions it's about testing changes and ideas for improvement. So you can figure out what works best for your service. And then you can implement a good practice and support innovation, which kind of leads us well into, well, why do we care about self-evaluation? So next slide, please, Jenny. I mean, you can hopefully start to see that we care about it because it gets people on board. Simple. Sorry, next slide, please, Jenny. It helps people to see, helps you see, it simply helps us get people on board. Sorry. Go back to the last one, please. Yeah. It helps get people on board. It can, staff can start to see why do we need to make changes so that people experience, so that people experiencing care and their relatives can see the changes, see the improvements, see what's good about our service. So it generates that buy-in. Next slide, please, Jenny. It helps the decision-making process, so you can make informed decisions about what do we need to do in our service to move it forward in a way that is beneficial to everyone involved in the service. It gives you that kind of starting point to figure out where are we at, so that we can then make a decision on where do we need to go. And then it also helps us monitor the progress, so we can always look at the distance we've traveled, where we were, where we are at now, and how do we know that changes have actually led to an improvement. It demonstrates good leadership and management within the service. And even on a practical basis, it reduces the possibility of any areas of improvement being picked up at your inspection, because you're already aware of those, you're already working on those, and because you've carried out a self-evaluation, you understand all aspects of your service that much better. But most importantly, it helps us recognize and celebrate successes, and that nothing's more important, nothing sells more than success, so when we know what's good about our service, it makes us want to be there. It makes people want to be getting that service from us. So hopefully this kind of gives you a little explanation, little bit more understanding of what we would describe in terms of self-evaluation. And bearing that in mind, let's ask you a question. So next slide, please, Jenny. Give us an idea now of your knowledge and confidence in relation to self-evaluation. How confident are you within your service in undertaking self-evaluation? So it's a scale. So you kind of get an answer between not confident at all to very confident, and you kind of choose where you feel you are at within your service, and kind of gives us a bit of a flavor of where everyone is, and makes it easier as well for Linda to then see how she's talking about the bits when she goes into a bit more detail about self-evaluation and social care.
Right. So we can see the model pulsing and moving as everybody gets is casting their vote. And we have some people who aren't using their phones, are using the chat instead, and they're up towards the 3s and the 4s as well. So without, you know, getting very technical about it, you can see that if it's over to the right, if there are more to the right, people are feeling more confident, and if it's over on the left, they're less confident. And we have most of the people over on the right hand side from 3 to 4 to 5. So I'd say that folk are feeling pretty confident about their knowledge and confidence around using self-evaluation, the service.
Which is absolutely brilliant
yeah.
to see.
Yeah, and that's reflected in the chat as well. Okay.
Cool. So I think that leads us really well into having a chat with Linda, and Linda's telling us a bit more about self-evaluation and social care. So are you able to come along now, Linda? If we move on to the next slide, please, Jenny.
Yeah. I hope everybody can see me a little bit better. The position in my wee office at home isn't always that good for getting some lighting. I'm really enlightened to hear all the things that you've just been adding to the slides there about how you get your feedback and how you know you're good. And that's really reassuring for us as well to know that you're really confident about self-evaluation. If anybody would like to have a wee informal chat with me after the presentation today, I would really love to hear if you've got any stories that you would be willing to share with us, because we're always looking for stories to share with other people that aren't as confident. So yeah, so welcome everybody to this short presentation on self-evaluation. As you can see, my name is Linda Taylor and I'm an improvement advisor with the Quality Improvement Support Team. So I've been involved in presenting self-evaluation and webinars and workshops for the last year or so, and just supporting services to look at implementation. And we're just in the process of producing some bite-sized videos that hopefully will be available soon, so watch out for that. We thought today might be just useful just to recap about self-evaluation and how we can use it to improve your service so that people get an even better experience. But it sounds like you're all really up to date with using self-evaluation, which is really good. And we acknowledge that services are at different stages. So I appreciate that some of the information that I'm about to talk about might not be new to some people. Okay, Jenny, could I get the next slide, please? So just to recap about self-evaluation and social care. Self-evaluation is really a continuous process that you can use to evaluate how good your service is and what needs to improve. And it gives you that baseline or benchmark to start your improvement journey. And it always asks these 3 questions: how are we doing? How do we know? And what are we going to do now? And it sounds like the majority of people here today are well aware of the questions and are using them within the service. So that's really good. These guidance documents that you can see on the slide are available to support your improvement journey. The self-evaluation for improvement, your guide, that's been around since about 2019. However, it still has relevant information that you're probably using. The self-evaluation tool guidance, apologies, you can't really see the heading there. That came out in 2022. And this is a useful document to support people with self-evaluation. It has links within the document to different tools and templates that can support you with self-evaluation if you want to use that. And I've got some examples later on. And we will have a link to some of the guidance at the end of the presentation. Okay, Jenny, next slide, please. Sometimes we get asked about where's a good place to start your self-evaluation, and that answers the first question about how are we doing. We need to gather evidence that will inform us of how good our service is and what areas need to improve. You might already be aware of areas in your service that need to improve, for example, through quality audits or maybe from feedback that you're getting, or you might want to use a requirement or area for improvement from your last inspection as a starting point. It's important to start with something, I think, that you feel will be achievable, particularly if you haven't done much in the way of self-evaluation before. But it sounds like a lot of people on the call are quite familiar with self-evaluation. But sometimes I think if it's something that's achievable, it kind of helps you and your staff keep motivated. Next slide, please, Jenny. You can use the quality framework to help evaluate how you are doing. You can use any of the key questions or the quality indicators or key areas from the quality framework. But obviously we wouldn't suggest doing the whole framework at once. Breaking it down into smaller chunks, I think people find that a bit more easier. You could use the quality illustrations and the support toolbox in the quality framework, such as the health and social care standards and best practice documents to help you evaluate how good you are. And you'll be able to compare yourself, for example, against a very good service and a weak service, using the quality illustrations and by using best practice documents from the toolbox. However you start your improvement journey, gathering evidence and being able to measure your service against best practice documents will help to establish your baseline and benchmark and to answer that first question of how are you doing. Our advice would be to start small, particularly if you're not familiar with the process. As I said, you would start with a requirement or area for improvement or one of the quality indicators. Starting small means that it's more manageable. So for example, if you wanted to look at improving personal plans, start small with maybe 2 to 5 plans. Or if you wanted to improve some of your dining room experience, you could start with just a small area in the dining room. Or if you wanted to evaluate medicine records, again, just start with maybe 2 to 5 files. Starting small makes things more manageable and it reduces the risks of mistakes. We do acknowledge that doing self-evaluation has resource implications and time can often be a barrier. So starting small supports you in that journey. Next slide, please. Getting feedback from people is crucial to finding out how good your service is, and it's really heartening that a lot of people here today are really using feedback to find out how good the service is. You're getting feedback from people who use your service, their relatives, carers, from all your staff and other people that are connected with your service, such as other professionals or stakeholders. It's really good to get that feedback, and it's really good to find out how good you are and get that very positive feedback. So how you collate your feedback will depend on the needs of the people who use your service. So thinking about how you can communicate, for example, you might need to use talking mats or symbols. We know that getting feedback can take quite a time and it can be difficult to obtain feedback. But getting feedback will help you organise a baseline that you need. And you can think about using surveys or small groups or even just speaking to people individually. And I think using sort of texts and emails now are quite useful for some people who use services. Next slide, please. This is a worked example from the toolkit, and this example demonstrates statements from one of the quality indicators, and it uses a 6-point grading scale to measure how good your service is, same as inspectors use. Using some of the key points from quality framework and putting them into questions that people can then grade your service on can be a useful way of getting feedback. And you can download these templates into a Word document and then create your own questions and wording to suit your own service. This example has got comment boxes, so people can add in additional information if they wanted to. Asking the right questions in the right way makes the feedback more useful and meaningful. Again, we suggest starting small as you might need to adapt some of the questions. Next slide, please. This is just an example from the Care at Home and Supported Living framework. Again, using the question, my support workers know me well and know what is important to me, and asking people to use the 6-point scale to evaluate how good you are. Next slide, please. You might be familiar with the recent publication of Meaningful Connections in association with Annie's Law, which has its own self-evaluation process, as you can see. It's similar to the one previously. It uses a 6-point scale and asks specific questions relating to themes or topics. And you might have developed your own tools and templates, which is great. Next slide, please. Gathering your evidence, the how do we know question, will help you to find out information about how good you are and, you know, setting that benchmark and baseline. You can get evidence, as we've said, from feedback from people who use your service and their relatives. Important to get feedback from your staff and relatives, doing observations of practice and just general observations throughout your service. And you'll get information from your quality assurance activities. And benchmarking against good practice and the quality illustrations are all good ways of getting your evidence together. Next slide, please. This is just a worked example from the toolkit. I don't know if people are using the examples or not, or you might have, as I said, devised your own. This highlights simply what you found and what you observed. So, for example, here they've looked at they found that 4 out of 10 risk assessments didn't include the signature of the person's representative. And they observed that relationships between staff and people using the service are warm and genuine. And 18 out of 20 people living in the service said their care and support was very good or excellent. So it's really important, isn't it, to get that really good news about how your service is doing. And in the focus groups, it was nice to hear that staff took extra time to help people feel at ease and help them to maintain their dignity. And whilst all people using the service reported feeling involved, there was 5 staff and 8 family members said that people and their families were not sufficiently involved in decisions. So that's given you some really good information about how good your service is and what you need to do next. Next slide, please, Jenny. So this answers the final question, what are we going to do now? This example has taken information from the quality illustrations and from the worked example that we've just looked at. So what we're advising people to do is, I know people find that trying to write up their evidence can again be quite time consuming, but it just could be bullet points, but writing things in sort of an evaluative way so that it clearly points out what action you're taking. So in this case, they're going to repeat the process in 2 months' time. They're going to review risk assessment process to make sure that appropriate people are involved where there are issues of capacity. So they're starting to tease out what action they need to take. Next slide, please. So once you've decided your priorities and what needs to be taken forward, you can add this to the improvement plan. Again, the improvement plan is on a link within the guidance, and you can use that if you want, or again, you might have devised your own. You can review the improvement plan as often as you feel is necessary. And what you're looking for is having these sections highlighted. So what is it you want to achieve? So looking at the previous slide that we had, there was an issue there about improved communication with family members. So that's something that needs to be achieved. And they want to update risk assessments with appropriate involvement from relatives. And how are they going to do it? They're going to send out fortnightly updates to family members and carers and review risk assessments. And there's a time frame there, which is important, when it needs to be completed by and who's going to be responsible for that. So it's quite clear who's taken on a lead role in making that action happen. And it's important, what are you going to do next? You know, where are we now? So have you managed to achieve that improvement, or do you need to review and maybe look at that in a different way? You can measure your sort of improvement, by example, for repeating questionnaires, surveys or observations. And inspectors will be really keen to see your self-evaluation process and your improvement plan. Next slide, please, Jenny. I'm sure you'll be familiar with all these guidance that are on the slide there, but it's just to highlight that the quality framework, health and social care standards, etc., and the self-evaluation guidance are really useful tools to help you put self-evaluation into place. So thanks very much for listening. I'm now going to hand you over to Louise and Eileen, who will discuss Tales from the Sector.
Thanks very much, Linda. That's great. Thank you so much. Eileen and myself, Tales from the Sector, it sounds like a great TV series, doesn't it, or something? Well, we'll try to live up to the headline there. So Eileen, lovely to have you with us here, and you're working up in Fort William, yeah?
I am, and it's dry today.
Excellent. Well, that's always that's a good start to it anyway. Well, we're chatting today about self-evaluation, and I heard that you found self-evaluation a very useful tool and wanted to talk to you about it. So I'd love to hear a bit more. So just starting with that one, like, why did you find it useful?
I found it useful. I'd struggled for quite a long time getting the grades up in the home, getting the standards up in the home, making sure that we had consistency. So a lot of the time our staff were very good, but sometimes we really let ourselves down as well. And I was quite lucky because the company I worked for invested a lot in doing quality improvement, which then led me on to the self-evaluation. And then when I started actually doing the self-evaluation and doing it with the staff, because of the training my company had given me, then we were able to do exactly what's just been said, break it into small manageable chunks, recognise what we were doing well, but also not get negative about what we're not being well, find a plan for how we're going to put those improvements in place. And it made a massive difference to our last inspection, and it made a massive difference to the confidence of the staff, because we allocated specific tasks to specific people who were responsible for their own wee bit. So nobody was overwhelmed, but they were all able to move forward at the same time with the service. And it made a massive difference to the residents and the relatives too, because they felt really involved in the whole process. You're on mute.
There we go. Listen, that's really lovely. And do you know, there's so much there that you mentioned about spotting what you're doing well. And that's something that Anna had spoken about earlier, but noticing the good things that are going on. That's really important, isn't it? Because
if you always concentrate on the negative stuff, it's really demoralising for everybody. And there's no home where everything's negative. Everybody that works in care is there to do a good job and to look after the people that we're lucky enough to look after. So nobody goes in with the intention of not giving great care. It's things happen maybe because the system's not right, because there's obstacles in the way of that happening, or people just don't maybe have the specific training in that field. But if you can break that down into the smaller bits and put that in place, then people thrive, both the residents and the staff.
Right. And then I love the other thing that you mentioned about is not getting too downhearted about the things that aren't going wrong. And I know in any sector, in any business, in any company, that fear of, that feeling bad about things that aren't going well or something that's going wrong, and sometimes trying to kind of gloss over it or hide it or not face up to it. But it sounds like you're really saying, look, here's the stuff we're doing so well, and look, here's the things we aren't doing well, and that's grand. Let's do something about it.
It's very much breaking it into wee bits, and it's also recognising that even if we did miraculously get up to grades of 6s, a year later there'd still be stuff to fix. You're never not going to have stuff to fix, and when it takes a while to get comfortable with that as a human being, because most of us would like to do things right and do it right all of the time. An awful lot of us have trained really hard to get where we are, And I think for a long time I expected that eventually I would get to a certain level and be able to keep it there. It took a long time to realise that it is actually continual improvement means continual improvement. It's never going to stop.
That is so true. That is so true.
Once you realise it's not going
yeah.
to stop, it's a lot more manageable.
Yeah, and maybe everything will only be perfect. We'll be at the pearly gates or something, because you know that's humanity, isn't it? It's human beings, and actually that whole thing about continual improvement, that we're not just stuck, that we're constantly interested and curious. But listen, tell me about. I know you tracked an improvement for every person who lives in the care home there. It was about connecting with family during COVID, and that tracking, I think people would really be interested to hear about. Could you tell us a bit more about that?
It was great. I used the Meaningful Connection, the self-evaluation tool, to go back and look at it. But one of the major issues that came up in COVID was communication with family not being able to travel to come up and visit people and stuff. And I think everybody had major issues with it. Everybody rushed out and got tablets to connect to people, and an awful lot of homes came up with really innovative ways of keeping people in touch. But it became apparent quite early on that certain people stayed in touch all the time, like their family would phone every day, and other people we weren't managing to meet their needs. So it's actually the activity coordinator, not me. I'm not taking credit for it. So with the feedback that came back from things like activities, what people were doing, relatives really wanted to see their loved ones and couldn't. She came up with the most simple plan you could possibly have. She had a list of paper with the residents' names down one side and a series of boxes. Has there been a photo of them doing an activity? Has there been a feedback of them doing an activity? Have they been in touch with a relative in the last week? And it is literally a tick box, and she's got 3 years worth of it now to make sure that every resident has touched base or done an activity, or even if we couldn't put a picture on Facebook, say it was somebody with very, very advanced dementia and it wouldn't be appropriate, she would send them a picture privately on Messenger so that they could, still be in touch. And we carried it on. We've just kept carrying it on to make sure that everybody's getting included every single week. And there's something for every relative to see.
Do you know, Eileen, I just absolutely love that example, and I'm sure everybody else in the call will as well, because it's that making sure that some people aren't left out, because and that's whether you're working in a daycare centre or a carer's home or care home, whatever, that some of us are more vocal and chatty and out there, and some other folk who are quieter or can't initiate things can get left out. And I love that way of just checking, is everybody getting connected and doing something about it? And you've described all of the different ways that happened. And now there's one other thing around that, and I think that I'm sure you mentioned, I just turn over my wee notes here. It was on the issue of movement and activity, and I think you introduced something about the trip to the dining room and what you did differently around that. Like, what was that about? Tell us about that.
Yeah, this is another thing that's ridiculously simple, and I don't understand why I didn't think about it 20 years ago. So we've got, most of our rooms are upstairs and we've got a main dining room downstairs. So for years we've taken them downstairs in the lift and walk them into the dining room, which is great. It's a fairly decent walk for a lot of people, but they're not getting outside. And this is Scotland, so there's not much sun, and there definitely isn't where we are. So really, really simply, our care inspector, Susan, had been in, and she was just pointing out about trying to get folk outside and making the most of our outdoor space, because we're very lucky to have really nice gardens. But there's a door out of one lounge, and if you then walk around the building through the garden, you can come in through the dining room. So what we started doing was taking people down, going out the lounge door, going through the garden, and then back into the dining room the other way. And that's now led on to having our alfrescos. We've got a wee group of alfresco lunches now. And as you know, if it's dry, they're out there and they have their lunch out there, and they love it, absolutely love it. But it means that the majority of people are getting outside in a garden a couple of times a day, and we're not actually having to do anything extra for that. It's just a very slightly different route into the dining room. It's made a huge difference to the actual residents, because I see them now going, our gardens are enclosed so they can go in and out whenever they want. But the fact that we are taking them out is making them go out more and use it more out with the dining room times. And that's making a huge difference to them. They love it.
And I love from that conversation what you're telling me there, that point that your inspector mentioned something. And I think the really important thing, Eileen, is that you're listening. You listened, and rather than saying plenty of people get outside, you know what I mean? You're looking at that evaluation thinking, I wonder now, gosh, maybe we can do something about this. And it looks like you're very open to hearing feedback or evaluations from other people as well. And I'm sure that's part and parcel of your success there.
You've got to stop seeing things as a criticism. Just because you're doing something wrong doesn't actually mean something's critical, and it doesn't mean it's wrong, but it does mean you've got an opportunity to make it better.
Well, thank you very much on that. And I'm going to take that to heart myself, and I'm sure everybody else in the call will. It's been absolutely lovely speaking with you, and I'm sure everybody else will join me in thanking you so much for your comments. And I think we could speak a lot longer as well, but I'm just keeping an eye on the time as well. So thank you so much. And I'm going to hand back, I think it's to Anij just now. Yep, there he is, to talk about the model for improvement.
Thank you, Jenny. Next slide, please. Hello, so it's back to me again. So we'll talk a little about the model of improvement. How do we think about improving with the model of improvement? Next slide, please, Jenny. So the model for improvement, it's simply about asking, it's a simple structured way to go about making improvements. So we start with the 3 basic questions. What is it that we're actually trying to accomplish? So what is our goal? Then looking at what are we going to track? How will we know that change is actually going to lead to an improvement that is actually something we want to get and it's not making other things worse? And then come your ideas. What idea are we going to try, or a group of ideas we're going to try to accomplish that goal that we want to go for? And then we do a simple plan, do, study, act cycle where we make a plan, including a plan on how we're going to track what we're tracking. We do it, we track it, we study what's happening as a part of our tracking. We'll look at what we track, how things have gone, and then that gives us the opportunity to look at, well, what can we do next? So is it working? And if it's working really well, should we do more of it? So should we involve more service users, or should we make this idea bigger? So if we started with, say, a herb garden, should we make it into the raised beds in the outside garden because it's working really well for the person? Or shall we have a few more service users do that gardening activity, and that kind of starts that community spirit, the connection with each other, as well as that taking part in a healthy activity that makes us feel better physically and mentally. But it might be that it's working, but not as well. And you're going to start to look at the information that you're getting and going, well, how can we muck about with this to make it work a bit better? So you adapt that, and then you do your plan, do, study, act cycle again. So we kind of think of how can we muck about with it? We muck about with it, and then we repeat the whole cycle again to track what have we done, where have we gotten to, and what are we getting now? But it might be that it's just not working at all. And all ideas, especially when they come from within the service, from the staff and the service users, they're usually good ideas, but not every ideas work for every service for a range of reasons. So but it gives you quick tracking, quick looking at, having a regular eye on it, allows you to abandon the idea at a very small stage when you've not invested a lot of time and effort and resource, and pick the next idea up and see, well, let's go with the next idea and see what we can do and see what it does for us. So that is, in a nutshell, model of improvement. Looking at what we're going to do, how we're going to know it's working, and trying it out and seeing if it works. And if it doesn't work, leaving it. If it works, what could be made better, mucking about, making it a bit better. And if it's working really well, making it bigger. You know, how can we make it a part of daily life? How can we introduce it to more services or more staff within the same service, and so on and so forth. So that's a simple explanation for the model of improvement. And you can hopefully start to see the connection it has with self-evaluation. So you find out where are you at, how do you know that this is where you're at, and that kind of feeds into your tracking part. And then what we're going to do now feeds really well and works really well with the change ideas and the plan to study at cycle. So, you know, what are we going to do now? What's happening? What are we going to do next? You know, so it kind of keeps it live, keeps it active, keeps it simple and small, so that by the time you make it bigger, you know it works. So you know your resources are not, you know, are going in the right direction. Next slide, please, Jenny. So we thought we'll share a simple blank PDSA template with you. So because quite often we talk to services and they take that on board when we're doing couple workshops and various webinars and stuff, but we see very little use of the PDSA within the service. We thought what we'll try today in the webinar is we'll maybe try and populate a PDSA together, and we'll share this simple PDSA template with you. We will send across a copy of this blank template to you as well when we send you the slides and the recording of the webinar. So it basically, again, simply, you know, has your aim at the top. What's the plan? How are we gonna do it, including what are we gonna track? And then we do the do bit includes what happened when we did things. We study that, and then we act upon our results. So, you know, that one sheet, one page gives you enough information to kind of keep working away with your idea. But as we go on, we'll try and do this interactively. We'll take an example, we'll do it interactively, and then hopefully by the end of it, if there is time, I'll try and populate a template in the background and show it to you towards the end. If we run out of time, what I'll do is we'll make that template, complete a template, and we'll send it to you along with the blank template, so you can kind of see how simple and easy it is for us to just work through together and come up with a template just like you would do with your staff. So next slide, please, Jenny. So going on to that, let's start with a question where let's have a chat a little bit about tracking, because, you know, that's the key, in a sense, the key aspect of once we know what we're tracking, once we're tracking it, it helps the PDSA cycle to work. So tell us, how does tracking changes, positive or negative, help us at our work, in your opinion? So anything you can think of, just pop your answers in using your phone. Jenny's kindly drop the QR code again at the side if you need the QR code again. So yeah, identifying improvements, strengths.
Yeah, so we see lots of different things that people are popping in just now. And this is kind of coming back to what Eileen was saying about if you can track improvements, you can identify things to improve, but also strengths, and helps people keep on track. It gives honest evaluation of what's happening. Happier workers, helping people keep regular engagement with what's going on, so that you don't just lose track of something, but if you keep tracking it over a period of time, it gives direction. There's different ways of doing it, like using diaries or notes, and tracking improvement is very good at helping people get kind of honest evaluation about what's happening in the area, and also very important that you can adapt as you go. That tracking helps with that. My goodness, there's so many different good ideas there.
I love the bits about positivity and staff morale, and, you know, because it's so important, especially the challenging times social care face, at least in times, you know, it makes it so much better when we kind of know things we are doing are making a real difference in life, and tracking's cracking for that. Next slide, please, Jenny. So thanks a lot for your brilliant answers. You've pretty much covered everything I've got in the next slide that talks about the benefits of tracking changes. So, but, you know, I'll not cover them all, but I would say that there's a couple of things that I feel are important to point out. Things like it helps to ensure that something isn't worse when other things are better. So you're looking at not just what we're doing, but how is it affecting other parts of the system. Tracking can really help with that. It can, like I was saying earlier, it saves time and effort as well. So when the change is small, when we have very limited involvement, if we can muck about with it and make it work best, then when we have more investment in it, we know we're on the right track, and our resources are going to be put to good use. And it helps that building that momentum, because like I was saying earlier, and as you can see, why do we care about self-evaluation and why do we care about tracking changes? You can see a lot of similarities in them, because knowing where we're at and knowing where we've come gives a lot of power in the change, the positivity that's happening in a service, and that helps us make the change work better. It kind of helps us change the culture within the service where everybody appreciates, enjoys that change we're able to make in people's lives. Next slide, please, Jenny. So talking about that, so what kind of things could you track? So there are kind of three key bits you could track. One is obviously the impact of the change you're actually making, so what's happening because of your improvement work. So, so if we're talking about social connections, for example, Mary's now visiting the bowling club and the church coffee morning after the carer spoke to her during her home care visits and helped her find out what's happening in her community. In a care home, you're analyzing maybe the feedback after maybe doing some person-centered exercises with your residents, and you've come up with a different activity planner based on what people really enjoy, what makes their day, what makes them happy. So you're tracking that impact, that outcome of what you've changed, what you've done, what your new idea is. You can also track the way we are working, so how, so for example, how well are we implementing our improvement ideas? So, if Jenny's been wanting to move more often by walking more, by going to the garden and doing some gardening, then the outcome would of course be how often she went into the garden, but the process would be how often did we offer Jenny a walk in the garden? Because the more we are gonna take the opportunity of offering her a walk, the more is the opportunity that the weather will be right, Jenny will be feeling just right, and therefore she'll say yes, and therefore she'll go out more. So the process would be tracking how many times have we offered Jenny a walk. But if we go back to our feedback example, it's like you would be auditing how many times did we actually complete a feedback form when we did an activity. So because we might not have a lot of outcomes when we are analyzing the feedback, but that's primarily due to that us not collecting the feedback after every activity as well. So, just looking at either what's happening or how we are doing it to make it happen. But there's also the unintended consequences aspect. So, when we add something, have we dropped the ball somewhere else? So when we are trying to create a new idea, is there other things we are not able to do? So sometimes it's a good idea to kind of track what's happening in other parts of the system. So there might be something specifically you feel, so example I've got here in front of you, like we've started a new group walking improvement, daily group walk improvement project, but some of the bedbound residents aren't involved with that. So looking at, has that reduced the one-to-one time we've spent with them? Because if it has, then it's improved outcomes for some, but reduced outcomes for the others. So we need to look at, well, how can we tweak that so that doesn't happen? Or, like in home care, so if you've introduced a change to the paperwork to make it a lot more person-centered, while staff are getting used to it, or because there's more for them to write, is that leading to changes in the average visit duration? Are staff having to spend longer during each visit? And what's the impact of that? Does that mean some people have poorer outcomes because their visits are a bit more rushed, as the shift advances? Or, is it impacting on staff time and they're struggling to keep to their shift time? So thinking unintended consequences can also be a very good area to track if you feel the improvement you're making might affect other parts of the system. So just a few things to think about. Next slide, please, Jenny. So we also going in line with self-evaluation and improvement planning, and a lot of feedback that we got from the services, that tracking was the one area that services felt they could take the most help from us, that they would find the most benefit. So we've developed a simple ways to track progress document. It's in a draft stage. We will be sharing that with you as a part of this work. But what we would love is when you get the slides and when you get that document, please try it out. Please have a look at it and then come back to us with some information. Our email address will be right at the end as a part of the slides as well. Come back to us and see what you think, what benefit it whether you feel it'll work in your service, whether it's working with your service users, or whether there are tweaks you can think of that would make that document even better. But we've come up with this document that helps you to track progress. It will offer some sample questions, that you can ask when you're tracking improvement, and I'll show you a few examples of that later on in the slides. And the idea is the first set of answers will kind of give you a baseline, so a starting point, just like self-evaluation does, and you'll see the similarity of this theme going throughout the webinar in what we do, what Linda advises, so that it's all simple, coherent, and works well together. You repeat these questions over time, you see the difference, that, how things have improved, how things have changed, that you're on the right track, and how you moved on. It'll give you some simple suggestions of numbers you can track if you're looking at numbers or outcomes, so like how many times somebody's gone outdoors, or how many steps somebody's taken, and has that changed, how much are they assisting with domestic activities if they've chosen to have more involvement in the day-to-day activities and routines. It's about is it about socializing, how many meals there for that person has eaten with other people, rather than by themselves, how many times have come to the dining room, how many times if they're receiving care at home, how many times have they felt confident and able to actually get to their front door to open the door themselves during the care visits instead of the carer letting themselves in. If they've set up a few activity goals, how many activity goals from the goals they've set up they've achieved. It also gives you some tracking examples and stories, such as a well-being tree. It's something we introduced last year in one of our track and improvement webinars. One of the services following the webinar took that as an idea, got a bit more information from us, and then they've actually gone and used it. So Louise will be talking through, they've shared their story with us, and Louise will be talking through their story and their images with you later on as well, so you can see that in action. But, like I was saying earlier, you'll see throughout the document and through the way we are working, it kind of mirrors and works very well with asking those important improvement questions as a part of the self-evaluation. How are we doing? And how do we actually know what we are doing is working? And, what's our evidence behind it? There's also a planning section right at the end of that track in progress document. And what you'll find when you look at it, it actually mirrors the improvement plans that you get in the self-evaluation guide in the toolkit very, very well. Because again, there are all synergistic things. It's about figuring out where we're at, finding simple ways to track that progress, and then making an improvement plan on the back of it. What are we changing and how has that moved the needle? Next slide, please, Jenny. So here's the examples that I was saying, a few questions. So I've just taken a few of those questions. So we've made it into like a simple scale, where you ask a question to a person such as, I get to do what matters to me. I can spend my time doing things I enjoy, or I feel as communicated to my community as I want to be. And we're not saying you ask each and every question. You can pick and choose. So make it as simple, as easy, and as short as you want to make it. So this is not here's a form, fill the whole form. It's here's a few ideas, pick whichever one works for you. That the simplest, easiest way for you to track where you're at and where you're going, and looking at some point in time what the change has been in my service. So if you can move the needle for somebody from not feeling connected to the community as well, especially say when they've just come into the care room and they feel like most of their community connections have gone by the wayside, but you work with them and you help them reform some community links and choose a few new ones. If they've gone from never to sometimes, then you can concretely say, in the last 3 to 4 weeks, this person's got a lot more community connections. Easy for you to understand, easy for your staff to understand, easy for the person to understand, easy for your inspector to understand. And that builds some motivation and gives you the evidence. So we'll try that in practice. Hopefully, Makaba do that just now. So next slide, please, Jenny. So let's PDSA. So your phone's out again, please. So some of those things that were in that question, we'd like you to think of Joe. Joe is one of your clients. who you want to make a change in their life using this tracking progress document. So what kind of thing would you want to aim for, from all the questions that we looked at? So like, let's say, so if somebody's being more active. So let's say Joe said he doesn't get to move about much more at all, doesn't get to move much at all, and he would like to be more active. And that could be the area that Joe's aiming for to make a change in his life. But you can choose making more connections. You can choose getting the most out of life, or it could be more specific. Joe wants to move more, but Joe actually wants to move more by spending more time outside. So what is it that?
Yeah, so I think the one that people would like to focus on just now is about being more active. Oh, sorry, doing things. Yes, being more active. So I think that's the one that we'll focus on just now.
Cool.
All right, so we can, and this is just for fun. The people in the room at the moment think, yeah, let's focus in on that one. So if we could move to the next slide there, please.
So before we get further into doing our PDSA, we thought, well, because we were talking about aims, we'll talk about SMART aims. So, it's thinking about when you do actually start making a goal with a service user, think about SMART, so make the goal specific, make it something that you can measure. And by that, I mean track. It's not all about numbers, so something that's specific, something you can track, something that is realistic and achievable for the person, and something that has a bit of time attached to it. So by when, so not just, we're going to do this, but by when do we want to do it? So a few tips around, you can't measure better. You can't, soon doesn't give you a time scale, and some is not a number, but you probably can measure more, track faster, or track safer if you've got a baseline, if you know where you're starting from. So you want more or less falls, you want to be able to do something in less time. So if you know how much time you take now, you can faster is a fair goal to have in your aim. If we are, safer is again, if you know how much of the incidents are happening in the building now, therefore, if you say we want to be safer, you would still be able to quantify that on the basis of how much incidents are happening now and how much incidents are happening when you track it a little bit further in the future. So a simple example here would be, so sticking with Joe will join at least 2 more regular community activities that he enjoys by the 31st of September. So we're very clear, we're very specific about what the change is going to be in Joe's life. It's very measurable because, we just want to track how many regular community activities Joe's joined. In Joe's context, it's hopefully really achievable because we know what all's going on in the community that we can help him support, encourage to get there. And he's got enough of a support system through us, through the other people in his life that can help him achieve that. And we'll put a timeline on it. We want to get there by the end of September. And that kind of thing is also very crucial. We want to make these aims smaller, easier, quickly achieved, and then we can set bigger aims, set bigger sights, but make it something simple, easy, so that we can get there. We can really celebrate the success for getting there, and then think, well, so what next? What more can we do now that we are really doing well? Okay, so we'll go back into our PDSA exercise. So next slide, please, Jenny. So we'll go back to our aim. So as Louise said from your responses, the key thing was Joe would like to be more active. That's the one we want to look at. So help me be a bit more specific. Give me a few ideas. What kind of things could Joe be doing to be achieving that aim of being more active? What kind of things could he be taking part in? So give us a range of your thoughts,
So we have lots of ideas popping up here, and you can think of a Joe at your service, somebody who's receiving care at home, somebody who attends a daycare service, or whatever. So using stairs instead of lift, I love that, absolutely, because we do tend to encourage people to remain seated often and to do everything while as easily as possible. But there's lots of things here to encourage people, to encourage Joe to get moving, to get going. And I can see some things about gentle exercises, seated exercises, chair yoga, etc. That's a lovely start. And remember that we're constantly trying to find ways to get people up out of their chairs, in order to move and to build strength and improve balance. So absolutely, if that's a starter for 10. Things that are fun, simple exercise, joining groups, accessing clubs, walking groups, attending an exercise class. And I hope he's been encouraged to stand up while he's attending the exercise class. You can see I've got a bit of a bee in my bonnet about this one. So fabulous. And I love the developmental stuff there. Strengthen exercise balance, build it slowly, small regular walks, gardening activities, going to the shop for a paper instead of delivery. And that's absolutely lovely. In a nutshell, it's gathering in about the day-to-day things. So it's what are the things that Joe is interested in, going to get your own paper, getting out of the house to do a bit of gardening or whatever it is. This is really, really important stuff about getting connected with your own life. And here's another one about previous hobbies. Like if Joe struggles to communicate, what was he interested in beforehand? Because chances are he's going to be interested in it now. And sit in to see how he gets on and ask him if he enjoyed it. So there's lots of really good ideas, Anna, here about encouraging and supporting Joe, because Joe says he's not getting from the evaluation, he's not as active as he wants to be. So tons of ideas about listening to Joe and building up.
And actually, some of them are really specific as well. Like we'll encourage Joe to attend an exercise class 3 times per week, so we kind of know, we can track how many times he was encouraged. So it's really good. Really, you're right on the money, right on track. So right. So let's move from plan to do. So next one, please, Jenny. So now that you've got an idea of things he could be doing, what kind of things do you think, considering the whole range that Louise has discussed, reading out your responses, what kind of things could we now be tracking in the do part of our cycle? So when we're actually implementing our plan, so let's say we picked up 5, 6 of those things that Joe will try and do to be more active from that entire list. What kind of things could we track? How would we know Joe's more active, in 2-3 weeks' time?
So here we have tracking, definitely about wearing a step counter, number of steps that Joe walks, attendance at something. And that's a really good one, because we can have the greatest of intentions that Joe's going to connect up with this walking group. But if you actually track it, you discover he only went for the first 3 weeks and then he hasn't gone back. So keeping a track of attendance. So lots of ideas about quantifying and tracking and how many times and documenting and observation. And that's lovely. Feedback, speaking to Joe, how's he getting on? And evaluating and monitoring over a particular 4-week period. And spotting that actually Joe had said that I'm not getting to be as active as I want, or staff aren't encouraging me to be as active as I want to be. Seeing, well, how's he feeling now that he is being more active in terms of mood and some sort of charts. And of course, because you guys know Joe really well, Joe, you have a fantastic relationship with the Joe who attends your service, that you're able to have these conversations and connections and really observations and seeing what's happening and so on. So there's some lovely ideas here. Feedback, talking, apps, monitoring, and so on. Okay.
Brilliant. Loving this. I think it's working. So let's move on to the next part, please, Jenny. Now we know what kind of things we could be track. Now, let's say you've done this tracking. What could the possible outcomes be? Say in 3 weeks' time, Joe's been doing these things. You've come up with a plan. You've tried a few things with him. You've got gardening, you've got walking, you're tracking his steps, you're seeking his feedback. you're asking about his feelings, about what does he feel about life? How active does he feel he is at the moment? You know, whichever way, whether you're using a feedback form or, you know, like our simple ways to track progress document. What is happening? So just imagine, so this is obviously more a imagination, something we're looking at into the future, thinking in Joe's suite. What's happened to Joe in the last 3 weeks? What could be happening? You know, what could be the possible outcomes that Joe is experiencing at the moment? What might be fine when we look at the steps? What might be fine when we look at Joe's feelings about how the last 3 weeks have been?
Yeah, and there's comments in the chat as well, Anich, which I know you won't be able to see just now, about care at home services and the problems about being limited and in terms of time and task, and absolutely, you know, acknowledging the situation that exists in care at home and the difficulties that that staff face with that, and in terms of finding ways, despite the difficulty in terms of the time that's available, and I think that's something we could definitely focus in on another stage, but just acknowledging that. So what might happen when we have a look at the tracking information? And so there's a nice difference. Joe's more mobile, his mood is lifted, and he's engaging more with others. Somebody thinks he might have become more sociable, he's feeling more active and happy, and improvement in mobility, health and well-being. And actually what you're saying here is backed up by, you know, all the research around the world in terms of when people are more active and involved, their health and well-being improves, they feel better about themselves and so on, which is why we're focusing in on that. So we have lots of really positive outcomes here when we look at the tracking information. And it could be, if you're looking at the tracking information, you realize that, say, if you're a care at home service that you were trying to encourage Joe, but you're only in and out in 30 minutes and it hasn't happened as much as you'd like, or maybe it's only one member of staff and not all members of staff, and you know, that's something else that you want to focus in on. So this study bit is about saying, what are we seeing, what are we noticing, what's working, what's not working, and as Eileen was saying, not seeing those not working things as a block, but okay, what are we going to do next?
Cool. So let's move on to that. So Joe's mood's better. Joe's walked a few more steps. Joe feels much happier in life. So on the back of that, what actions could we now take? You know, looking at Joe's experience, what actions might you now take? Looking at that, what's happened in the last 2-3 weeks for Joe? What might your next steps be?
Right, and some very useful suggestions and ideas here about, you know, if things are working with you, about, well, what's his next goal? Because what's his next goal? There's something around looking beyond yourself. So rolling it out with other folk, getting the family involved, which of course can work in all services, helping to maintain the routine because that it now becomes just normal, or sharing his success, looking to see what does Joe want a new goal, celebrating and coming back to that lovely thing that you had mentioned earlier on, and Eileen did as well, about it's so important to spot the things that are going well, and looking long term, saying, okay, this is now working, but let's really keep a focus on it so we don't, to prevent decline or deterioration, and adjusting. And I think all of the suggestions here, Anish, they really reflect what Eileen was saying, was about it's continual improvement. So it's not one and done. We can dust our hands off and say, okay, Joe's fixed, on to the next person. But how is it integrated into absolute day, you know, family involved, other people involved, new goals, spotting what's going on, and keep on the upward phase of working with you.
Brilliant. Thank you. This is really good. So it gives us so much And you can, hopefully you can see yourself from all your responses, how easy it is to kind of populate and start thinking about the plan, do, study, act as a system, as a principle, and how then that helps us lead into making our further decisions, as to what more can we change, how, and sell that success, share the success story, look at new plans for Joe, look at how we can make this a part of his day-to-day life, because he's made this change and will bed this change in. And let's look at, once this change is bed, what else does he want to achieve now that he knows he can create success, and you can create success in a very short space of time. What more can you do? Brilliant. So I'll hopefully try and populate this into a PDSA document template that I showed you earlier. And if you're able, towards the end, we'll try and see if we can show you what the template looks like, and we'll send it along to you as well once the recording is ready, and we're sending you the recording and the slides along with the other stuff. Cool, perfect.
Okay.
Next slide, please, Jenny.
Right, now back to myself and Shannon. I'm hoping that you might have managed to be able to put on your, oh, you are fantastic.
Hi.
Shannon was having difficulties earlier on, but we're both got cameras and mics on, so lovely to meet with you, Shannon. So you're working at Queen's Manor in Edinburgh, so from Fort William to Edinburgh. Lovely to have you here today.
Thanks for having me. It's nice.
That's great. Well, we're talking about self-evaluation, as you know, and I'd love to have a chat with you about your story, because again, it's starting with an inspector, I think, in this stage, and tell us what happened. So what was the deal like?
So it was, like you said, it was off the back of our care inspection, and it was discovered that within Queen's Manor there wasn't quite as much access to the outdoors for residents living on our first floor. There's keypads to go down the stairwells and for the lift, so there wasn't the free movement that we would have ideally wanted. And this encouraged a lot of conversations around the home around, well, we've known this is an issue and it's been flagged to us, so what can we do to change it? We were declined a rooftop garden, outdoor lift and an infinity pool, so we had to then look at reasonable options we could do. And we then got into lots of conversations with relatives, residents around what we can do, lots of surveys and lots of questions. And then we've now implemented our Time Out Together, which is an initiative we've been running for 3 months now.
So what's that? What's Time Out Together?
So Time Out Together is every Monday and Friday at 2:30. There are no activities, there's no reviews, there's no meetings, apart from emergency cases within the home. But at that point, every single member of staff in the building, apart from core members that need to stay in the kitchen, perhaps if they're cooking or doing medication, they stop. And it's the time that we get everyone that wants to outside. To do some social interaction, activities, just walk, just be outside.
So wow! So this is all the staff and all of the residents. And how many people are living at Queen's Manor?
We've got 60 residents, 30 on the first floor and 30 on the ground floor.
So are you trying to encourage 60 people to get outside and all of the staff?
We are, yes. So it's it came with its trial and error, like most things, but it is amazing. And through our surveys, what initially we thought was a first floor issue, we actually realised it was an issue throughout the whole home. It wasn't just a case of residents on the first floor couldn't use the lift. It was resident in room 30 is in a wheelchair and had no assistance to get outside, or the lip of the door from our patio had too high a gradient, so she couldn't self-propel herself outside. So it raised all of these other issues that we never thought of, and it's all come together and ticked quite a lot of it and fixed a lot of it.
Wow! And yeah.
Sorry, I'll let you go.
No, I was just wondering, and so twice a week, 2 days a week, you're encouraging every resident to go outside. And how many people take you up on it?
It changes every week. It's very weather dependent, which we include in all of our evaluations. So after every time we do the Time Out Together, it has its own evaluation form with resident participation, staff participation, weather, the activity we're doing at the time, so we can track and see what works and what doesn't. And it can be anything from 12, the most we've had is 43.
Gosh.
So it's over half the resident base of the home taking part, which is a massive success for us.
Yeah, and it seems that you're tracking it for everybody as well. So you know, say the person who wasn't able to get over the lip of her, you know, out to the patio or whatever. So you're trying to make it work for every single person, not just some people.
We are, yeah. So it goes from everyone that requires additional assistance as well. So what we've also done off the back of this is a lot of our auxiliary staff that aren't carers, that don't need to know, you know, how to use a stand aid or anything like that. We've went through the additional training so that in that time, yes, we know that's not our core role, but at that time we can help to assist everyone outside. There's more people in the building that are trained and know how to help and will, so that it's making it easier for everyone to achieve the goal of being outside.
That's fantastic. And listen, there must have been an awful lot of things you had to work through and to get to this stage. So how did you keep going, you know, when things were getting tough? You know, how did you overcome all the obstacles along the way?
A lot of chatting with our general manager and the team. We're very much a whole home approach, and sometimes it can be difficult. You know, you've got lots of your eggs in lots of different baskets and talking to all the departments, but it worked really well just to communicate with it. And as a home, we were very open with our regulators and our relatives. So we got relative involvement as well. So at the very start, we had to do an abundance of risk assessments, which meant that we were asking relatives to purchase new shoes for their parents, their loved ones, to look at anoraks and jackets and sun hats, just to make sure everyone is safe in the activity itself. And that got a lot of engagement from the relatives. You know, we've had more relatives coming in at that time because they know that the staff are going to be there to support them with their loved one. Perhaps they're not as comfortable pushing their mum in the wheelchair, or they want that extra stimulation around. But the involvement from the relatives significantly helped as well.
Yeah, fantastic. So so I love this idea that it came from kind of an evaluation. You said, okay, we're going to do something about this, and you had to get through a whole load of different obstacles. And you know, I'm sure everybody in the call is putting their hands on their head thinking of all the risk assessments and then all the different things. But you really involved everybody. You've involved families and so on. And I'm wondering, what difference has this new thing, because you've been doing it for 3 months now, so what difference has it made to the residents and staff and families and so on?
So personally, I think it's made a huge impact. We've had a reduction in stress throughout the home, anxiety. There was that was the peak time where we saw just after lunch there was more just stress in the home. There was more people wanting to go outside that perhaps couldn't beforehand. So we had the reduction in stress. We had an increase in enjoyment, an increase in people taking part in the activity post time out together. You know, they'd already had the mental stimulation to kind of wake up after lunch, so they wanted to take part in arts and crafts after lunch or our music and movement. So we had the increase in other general activities. So for residents, it was great. And also it helped us with residents moving in. It was a large scale project that helped them feel included immediately. They could get to know residents, they could get to know staff and visitors. We're very much a visitors and family are our family as well, so come and join in. We had our community police officers taking part 1 week, so it's really taken off and grown arms and legs. Yeah. In terms of staff, I don't know how any other care home or facility feels, but it can sometimes feel a bit disjointed for staff. In terms of our kitchen assistants don't really speak to our housekeepers that much because there's not an overlap, a crossover of opportunity. So because every single member of staff puts their tools down, you're getting to chat to people you not necessarily would get to speak to at the time. So you're increasing the morale that front, the team feel of the home. Selfishly, my office has no windows, so I love it because I get fresh air. Same with our general manager. You know, you're sitting there and you're working on a laptop all day. You don't realise that you've not actually taken a true breath of air. So it's giving you time to reduce your stress as well and increase your own morale as well as the overall home.
Yeah, fabulous. I
Lots
just
of
love that.
benefits.
Yeah. And again, this you know, what you're doing, all of the research would complement what you're finding out, because of course, all of us as human beings, our health improves when we're in connection with nature in different ways and when we're outdoors. So you know, this new thing that you've brought into Queen's Manor has to have a positive effect on people, because you don't have to do a research study to show that, because it's reflecting all the research that's been done already. That's fantastic.
And it's now fully embedded as well. So initially at the start, we had the staff that were saying, oh, we forgot it was time out together, and you know they didn't. They just perhaps didn't want to take part at the time. But now it's truly every single member of staff knows that at 2:30 Monday and Friday, it's a chance to get outside, and they're enjoying it. They're enjoying spending time with the residents.
Fantastic. Listen, Shannon, thank you so much. We could keep chatting about this, and I know in the chat people are really complimentary again about it. But so thank you so much for getting involved. I know we're almost at the end, so we better crack on. We've just got a couple more things to do. And Jenny, if you wouldn't mind going to the next one. And this is a tale from Sandra Tom Can't Be Here. Oh, sorry, here's our, I forgot we had these fabulous photos from Queen's Manor. This one here, which is lovely. And the next one again, Jenny. Do you know, photos of, you know, people out and about doing their thing, it really brings it to life, doesn't it? Oh, that's so lovely. Thanks for sharing the photos as well, Shannon.
You're welcome.
Okay, so on to the next one is I'll just very quickly talk about this. This is the Wellbeing Tree from Sandra Campy with us today from local Lanarkshire Care. And they took this idea about a wellbeing tree, and they had somebody who's a fantastic artist, as you can see, who drew the tree. And they focused in on what sparks joy in people's lives. So what do they do to keep themselves active, healthy, or sparks joy? And what we can't see, because we're not zoomed in, but there's people's names. So for example, there might be Louise, and for me, that I love going 10-pin bowling, and I'm involved in feeding the birds at the bird table. And you can imagine that as people have, this is within it's local Lanarkshire Care. So there's people in and out, different groups and so on, and folk, while they're in, talking about and putting up on the tree what works. They bought these Post-its that have that are shaped like leaves, which is really lovely. And there's lots of conversations with people. And again, that relationship thing, where lots of conversations with different people. And I know the folk who use this service and come in and out, may have autism, may have communication problems, and so on and so forth. But this has been really helpful to spark those conversations about what do folk really like doing. And they included some information into their newsletter, so folk, when they're into the office, can know what it's about and so on. And from this as well, they also got involved in more gardening and so on, and people planting sunflower seeds and bringing them back home and sending in photos. So there's some lovely ideas around this, and also conversations about future events. So thank you so much to Sandra for sending in this idea about using a well-being tree, about what sparks joy in people's lives. And I'm sure we can each of us pick up some ideas from that. So we're close to the end. Now, what's really important, if you can, is to pop in, is in the chat, there's an evaluation form. And we'd be so appreciative if you were able to go in and click on that at the moment and fill it out. Because I know once you leave, you've got busy lives, things will be calling for your attention, and you'd really so we'd really like to do that. There's one more slide where you'll be able to put your ideas forward as well, that Anij will take us to. So there's two more things for you to do. One is the evaluation form, and one is the slide on the on your phones. So back to Anij for the last bit.
Thank you, Louise. Jenny, are you able to take this down for a few minutes? Because I can maybe hopefully show where we're at with the PDSA template just now. Perfect. So if you all bear with me a minute, I'll share where I've got to with the PDSA template so you can see what we've made of your responses. So there we go. Hopefully you can see this okay. So like I said, it's a very basic, simple template. So in the aim, I've got down Joe would like to be more active by moving more often in his day-to-day life and adding at least 2 experiences in life that help increase his activity levels by the 31st of September. So we've kind of made it specific. We've kind of made it a bit more measurable, and we've put a timeline on it when we want to get it done by. So in terms of plan, how will we do it? So I picked up a few things that you guys had said. So we said, he'll use stairs instead of lifts. He'll have meals at the dining table instead of in front of the TV. He'll do some gardening, growing some veg and flowers. He'll try some chair exercises 3 times a week. He'll try some nature walks with his family. And as a plan, we also said we'll purchase a strap tracker and use it regularly. And staff will charge the tracker overnight. So it's always available for Joe to put on in the morning. So in terms of measurement, so what we're going to do, how will we track, what will we track? So we said, we'll look at our steps walk daily and weekly, and we'll think about figuring out Joe's feelings and opinions about his activity levels. So in the doing bit, I've just put down, we have looked at sorry, it's just a test. I didn't know it was going to happen right now. I apologize. Okay. So in the doing part, I put down steps that we populate on a simple step chart daily, and we calculate weekly totals every Sunday evening. We are using Kappa track in progress questions to figure out if Joe feels he's as active as he wants to be. And we're using activity feedback forms after each new activity that ask him, what went well in it, what could be better next time, whether he'd want to do it again, and how is he feeling after taking part in the activity. And I've also put down in the do bit, in the first week of the change, we just counted the steps before starting on any of our new ideas. And we also asked Joe, how that question around, I am as active as I want to be, so that we have an answer from, where is Joe? Is Joe saying rarely? Is he saying never? Is he saying sometimes? So we know if that needle has changed in a few weeks' time. So in terms of study and act, I put down study, very simple. Joe's mood is better. He's walked more steps on average compared to previous weeks. So we know he's, there's a change in his feelings. There's a change in how active he feels he is, and how many steps he's walking. And so act part. So in the act part, we've looked at goal setting. So like somebody had suggested, well, what's the next goal? What does Joe want to do next? Because he's progressed really well in it. We're getting family involved more so that they can help maintain and enhance his progress with his activity levels. So that we're working together and we're sharing the good progress. And I've also put down write Joe's success story and celebrate it through multiple means. So we can make Joe see the change it's made in his life and help other people see and want a bit more of that change that Joe's got. And it's very basic, it's very quick, it's very simple, but what I would say to you is as basic, as quick, and as simple as it needs to be. You don't have to make it more complicated than that. Just figure out what you're doing. Is it working for the person? And if it's working for the person, we're on the right track. And then figure out what we can do next. Louise?
So, and it's just popping in there because folk are heading off because I realise that we're out of time.
Oh my.
So, Jenny, if you wouldn't mind putting back up the last AHA slide question, and folk may be able to populate. We'd love to know if you're going to do something different after today because of your involvement here in the webinar. So if you have any things that you might do differently after today, we'd love to hear about it. But it's been lovely having you all here. We've really appreciated the huge involvement from everybody, and Shannon and Eileen for taking the time to come along and tell their stories. And in future webinars, we're always pleased and looking to share good stories on the topic in hand. So keep an eye out, and you might be able to join us at another one and tell us about the good work you're doing and so on. So as I was saying just earlier, if you were able to pop something in here, that's marvelous. And do remember to click on the evaluation form that Jenny has put in the in the chat. So 2 wee things. So thank you all very much, and appreciate having you here today. So enjoy the rest of your day.